Hello, I'm Dr. Judith Boice. I've been reflecting on the different systems of medicine, conventional, functional, naturopathic, and vital medicines, and the differences, the similarities between those four systems of medicine. I'm going to define them briefly, give you a musical analogy, and then also talk about the gifts and the challenges of each type of medicine. So, brief definition. Conventional medicine aims at identifying symptoms, whether that's through laboratory testing or physical exam, and then giving drugs or surgery, sometimes a few other procedures that are aimed at blocking or stopping the symptoms that are occurring. So, for example, if someone has high blood pressure, you give beta blockers. If someone has a bacterial infection, you give an antibiotic. You do something to block the whatever the process is that's happening. Functional medicine was developed by Dr. Jeffrey Bland, PhD. He's a biochemist who, by the way, taught at the National College of Naturopathic Medicine, one of the naturopathic medical schools in the 1970s. That's where he learned many of the principles of naturopathic medicine that he has applied in the development of functional medicine. We'll talk, though, about how he learned deeply 4 of the 5 principles, but he kind of overlooked one. So here's Dr. Jeffrey Bland's definition of functional medicine. Functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. Each symptom or differential diagnosis may be one of many contributing to an individual's illness. So remember, he's biology-based, he's a biochemist, and we'll be talking about that more in a moment, about how biochemistry is a big focus in functional medicine. Naturopathic medicine is a system that is characterized by its philosophy more so than specific treatment types. Naturopathic medicine can utilize many different types of treatment, and it is the philosophy of naturopathic medicine that unifies the use of those different medicines. And vitalism, or what I also call classical medicine, are systems of medicine that share the understanding that the body heals when you engage the body's own innate ability to do restoration work, the vis medicatrix naturae, the healing power of nature. Our bodies have an innate intelligence that allow us to repair. So for example, if my computer's damaged, or the table or the chair that I'm sitting in, those objects do not know how to restore themselves. They do not have an innate vital power that allows them to restore. Our bodies do have that innate restorative capacity. So vitalism, or what I call also classical medicine, all those systems of medicine aim to engage the body's innate ability to do its own restoration work. That's naturopathic medicine, Chinese medicine, Ayurvedic, Tibetan, also the older roots of Western herbalism, all aimed at engaging that vital force. I promised I'd give you a musical analogy, and I have a background as a classical musician, and so music often is a good way for me to explain things. So I was trained, as I mentioned, as a classical musician, and I somewhat jokingly say I was paper trained. I learned when I began playing music that you looked at these notations on a page, and when you saw this mark at this place, then I would put my finger at this place on the violin. So I learned note by note by note by note how to play music. It wasn't until I played for a year or two that I understood about different key signatures. Also, that there were major and minor keys. And then it wasn't until I got to the conservatory and started studying in the conservatory that I learned more about chord progressions and the structure and the form. Like, for example, there's a difference between a sonata form and a concerto form and a symphony form. There are different forms in music. I didn't learn that till much later. In contrast, jazz musicians, they learn structure and form from the get-go. They learn scales, also modal scales. I didn't know what a modal scale was until I got to the conservatory. They learn all kinds of things about a theory of music, structure and form of music, so that they can improvise. They're not just randomly pulling notes out of the air. They can improvise, and they can improvise beautifully because they're improvising within a structure, within a form. So to take this analogy, or let me give you an example of this, this difference in musical training. in my own experience working in the conservatory, studying in the conservatory, one of my classmates who was also studying with the same teacher, Paul, was both classically and jazz trained. So he was performing one time the Tchaikovsky Violin Concerto in front of the studio class. And if any of you have ever heard the Tchaikovsky Violin Concerto, it's long. It's a marathon. It's technically very difficult, and it's also very long. So the first movement alone is about 20 minutes of music. So Paul was playing the Tchaikovsky Violin Concerto. And because he had his jazz training, he not only had learned the note by note by note by note, he also had learned the chord progression and the structure and the form of Tchaikovsky's work. So if he ever lost his place while he was performing, he already knew the chord progression and the structure so that he could improvise from point A to point B. And it might not have been the exact same notes that Tchaikovsky wrote, but it sounded beautiful because he was within the structure and the form that Tchaikovsky was writing in. So he was able to draw on his jazz training to be able to serve him and his classical performances. So how does this classical jazz analogy relate to medicine? In the conventional world, for the most part, people are trained like the classical musician, like I was trained. You go note to note to note to note. You do this test, you find this symptom, you give this drug. You go note to note to note. In contrast, the naturopathic system of medicine and the vitalists are trained deeply in structure and form. So, for example, the classically trained conventional physician does learn biochemistry and physiology, but generally the purpose of learning biochemistry and physiology is to learn how to override the biochemical reactions that are happening, how to subvert the physiological things that are happening so that you can block or suppress the symptoms that are happening. I learned many of the same things that a conventional physician learns, and we had all the same classes: biochemistry, physiology, anatomy, etc. But it was learned within a completely different paradigm. The paradigm was aimed at engaging the body's own innate ability to do its restoration work. So instead of using biochemistry to suppress symptoms, we use the biochemistry and the biochemical reactions to augment what's going on in the body and support the innate healing capacity in the body. So it's a very different, same information applied in radically different ways. And what about the functional medicine world? Here's an interesting note, is that I mentioned earlier, Dr. Jeffrey Bland, who founded functional medicine, worked at the National College of Naturopathic Medicine. He taught nutrition in the 1970s. So he learned the philosophy of naturopathic medicine, which is the structure and form. So let me describe some of the components of naturopathic medicine that Dr. Bland incorporated into functional medicine. He incorporated identifying and treating the cause. He incorporated treating the whole person. So he has an understanding that multiple factors could contribute to the development of a single disease. He incorporated the doctor as teacher, docere. The Latin word of doctor is docere, which means to teach. So he embraced the understanding of education being a core part of a functional medicine physician's job. What he didn't embrace, though, was this understanding of vitalism, engaging the body's own innate ability to do its restoration work. So I don't know if you've ever seen a biochemistry poster. They're incredible. If you've never seen one, I'd encourage you to find one and look at it. It's itty bitty font size, and this entire 24 by 36 poster is covered with all of these different biochemical reactions, and this one feeding into that one, and this one going to that one, and these three things feed into that particular reaction. It's just a marvel. Our bodies are a marvel, a work of art. The job of the functional medicine physician, from Jeffrey Bland's understanding, is to go in and tinker with all of those biochemical pathways. And in that process, you use testing, just like the conventional medical doctor, you use testing, and generally it's more updated, more appropriate testing. You find breaks or changes in the biochemistry, and then you give natural supplements to address the breaks or the changes in the biochemistry. It's still a take this for that model, just like the conventional doctor. You have this show up on your test, you have this symptom, you give that drug. Well, in this case, it's just substituting nutrients, amino acids, different supplements for the drug, but it's still the same paradigm. Take this for that. And actually, you can also practice natural medicine and the same take this for that paradigm. So, for example, take echinacea for colds, take comfrey for wound healing, take this for that. You can enter natural medicine, and most people do, with this still very simplistic structure. So Jeffrey Bland embraced part of the naturopathic medical philosophy, and then he systematized it for conventional medical physicians. What the functional medicine physician is missing, though, still is what the jazz musician has, and that's the deeper understanding of structure and form and the ability to improvise and to engage emotion. That's part of what is so different about a jazz musician. And the piece that's missing, that is present in naturopathic medicine and all of the systems of vital medicine that I mentioned, or what I also call classical medicine, all of those classical systems of medicine understand the importance of engaging the vital force so the body can do its own restoration work. So, for example, with that biochemical pathway chart, often, not always, but often, the body has already figured out workarounds for a particular problem in a biochemical pathway. So let's say this particular biochemical pathway is not functioning well. Well, the body's already figured out 2 or 3 workarounds to get around that particular pathway. Sometimes there truly is a break and the workarounds have not been successful. Like a lot of functional medicine physicians talk about methylation pathways. You have to make sure all your methylation pathways are working. And I remember when I worked at cancer treatment centers working with a particular functional medicine physician, it finally dawned on her one day. We'd understood this for years in the naturopathic physicians who worked at the cancer treatment center, but it finally dawned on her that by supporting the methylation pathways, we might actually be helping the cancer. Yeah, that's right. So she was so busy focusing on that note by note by note by note. There's a break in the pathway. Let's insert this particular natural supplement and it'll take care of that symptom. She wasn't looking at the big picture structure and form and how that might actually, that small act might actually impact the larger form and system of the body. So yes, there are times when there definitely need to be particular breaks or deletions in the biochemistry that need to be addressed, but often by engaging the body's innate vital force, the body will take care of those adjustments on its own. If you give the body the correct foundational cornerstones that it needs and engage the vital force, it will do its own restoration work. So that is part of what characterizes naturopathic medicine and vitalism from the other systems of medicine, from functional medicine and conventional medicine. I'll give you one other analogy to think about vital force. Think about everything in your house being wired for 120 volts. What would happen if you ran 1,000 volts through that wiring? It would blow up, right, or melt down. Imagine that, for analogy's sake, imagine that disease operated at 120 volts. That was the voltage of disease. And you did things within the body system to increase the voltage to 500 volts, 1,000 volts, 2,000 volts. That 120 volt substance doesn't stand a chance at that point. That 120 volt disease is not going to be able to survive that upregulating of the vital force. That's the core understanding of vitalism. If you upregulate the vital force, the body can then go about doing the restoration work, the recalibration work that's needed to bring about full health. Not just to tinker and take care of this pathway and that pathway, but to engage the body's own innate ability to do its restoration work. So I don't mean to throw the baby out with the bathwater. Conventional medicine absolutely shines when it comes to injury or acute disease. So for example, if I was in a car accident and I needed surgery, I want the finest conventional surgeon possible. And I want to be given the state-of-the-art treatment for that injury. If I have a broken biochemical pathway and my body hasn't figured out a workaround, it'd be beneficial to have the paradigm of the functional physician applied. If I have, though, the desire to increase my health and vitality, to have more energy, to address a chronic illness that there are no answers for in the functional or conventional medical world, I want vitalism. I want vital medicine. I want something that's going to engage my body's own ability to restore and heal itself. So those are the different systems of medicine. I hope you've gotten a clear understanding. Each has its different gifts. Each has its different challenges. And quite frankly, if you're interested in full vital health, the note by note by note by note system is not going to get you very far down the road. If this has been of interest to you, please do join me. I'm going to be offering a webinar coming up. It's a 90-minute webinar, and it's called Radical Health, the Ninefold Path of Radiant Wellness. And in this webinar, we'll be looking at these different systems of medicine. We'll also be looking at a paradigm of health that will allow you to create health rather than simply eliminate symptoms. So keep your eyes open, watch for that webinar, Radical Health. I look forward to joining you in the webinar.